So what we're going to be left with is either heparin or Lovenox. Lovenox is actually a type of heparin, and it's also known as low molecular weight heparin. So it's a very refined form of heparin. Heparin has been around for decades, and it works by inactivating thrombin, which prevents fibrin from turning into a blood clot. So again, we talked about the coagulation pathway. There's certain steps that have to occur in order. So thrombin is one of the steps, and then fibrin is another step. Now with the heparin, it disrupts that. So if you inactivate thrombin, it'll never allow the fibrin to turn into a blood clot. But again, heparin doesn't come in a pill. So you have to give it either injected under the skin or IV through an infusion. There's also a risk of something called HIT, which is also known as heparin-induced thrombocytopenia. So HIT is very serious. Almost 5% of people who receive it will develop this complication. There's two different types of it, but the more serious one is actually where the immune system unexpectedly creates an antibody against heparin, and it starts to bind all the proteins. Another name for that protein is called platelet factor number 4. The problem is once the antibody is activated, all of the platelets get used up. It causes thousands of tiny blood clots to develop all throughout the body. So again, we have a woman who's got a blood clot in her lung. We give her heparin, which is a blood thinner, but unexpectedly the body reacts to it and makes more blood clots. So all of the platelets get used up rapidly, and there can be bleeding spontaneously throughout the body. And it spreads not just into the arteries, but also into the veins. And those people actually have to be admitted to the ICU because they will die without treatment. And so they have to be given other blood thinners in order to counteract that. So again, about 5% of people on heparin will develop this unexpected complication where they actually develop more blood clots. Now, the other form of heparin, which is called Lovenox or low molecular weight heparin, is much safer. There's a less than 1% chance of developing HIT. And this one is injected under the skin, and it can be safely given at home. So many people who have it, including pregnant women, are started on Lovenox, and they have to take it every single day for the rest of their pregnancy. The reason, again, if a woman is 12 weeks pregnant and she just had a blood clot, she still has 2 more trimesters to get through. So she has to take the Lovenox every single day to prevent recurrent blood clots from developing. Now, when a woman goes into labor, the doctor will stop the Lovenox because we don't want excessive bleeding. We don't want a hemorrhage to occur either with a vaginal delivery or with a C-section. But as soon as she delivers, probably 12 hours or 24 hours later, the doctor is going to restart the Lovenox. So again, after a woman has a delivery, we have to be sure that she restarts the Lovenox because there is a risk of developing complications with blood clots in the first 6 weeks or so after having a baby. So in that situation, the Lovenox will be continued. It'll be stopped at the time of delivery, restarted after delivery, and then continued for another 6 weeks. And then at that point, the doctor will decide if she needs to stay on the Lovenox or stop it altogether. So again, I want to thank Aaron for sending in a great question. You can visit his website, which is phoenixcenterhc.com. You can learn more about the skilled nursing facility and the services that they provide. And you can also visit our website to read the show notes about today's episode. So we talked about a lot of things. So blood clots, there's different types. There's thrombosis, which is in the leg or the arm. If it travels, that's an embolism. If it's in the lung, it's a pulmonary embolism, also called a PE. And if it's caused by something that needs to be identified, we do a VQ scan or we do a CT scan, and then we choose the medication, which is probably going to be Lovenox, but we can also use heparin if that's the only option you have available. So I hope you learned a little bit about these details to share with your family and friends. If you have questions you've been thinking about, just record it on your phone or your computer and email it to us. You can also visit us on social media, and you can send it to us via email. So visit us on our website, www.simplehealthradio.com, and I look forward to having you back on a future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.